I'm one of the lucky ones that have been a nurse for 20 some odd years. I've been a nurse through the nursing shortage, through the sales of the hospitals. I started out as a PCA. As nurses, we're in the unique position to be part of the community. We are the community, but yet we're in the workforce and we're taking care of people. Many of us have family members that have disabilities. We have senior parents, much like the community. This is just a very personal thing for us. We need to work, we need to make a living, we need to care. We do care about our patients, and we need to be able to do it safely for them, for us, and for our families.
I'm striking because nurses deserve good health care. It's ironic that a hospital whose mission is to provide excellent health care tries to take away the excellent health care that the nurses have. Without the current insurance, we would lose control over our plans. Currently, they cannot diminish benefits or lower our plans or increase the deductibles. However, if we went to the core plans that Allina wants us to go to, we lose any control over those plans.
We tried to bring it forth to Allina. We wanted to talk about safe staffing, the nurse-to-patient ratios, and they wouldn't discuss that, or workplace violence. They wouldn't discuss that either until we agreed to go to their core plans. Well, we're not agreeing. So our talk with safe staffing and workplace violence has not continued.
I'm Katie. I'm a nurse on the ICU and a member of the negotiating team, and I'm here because I care about my contract. Having worked in a non-contract facility before, I know what it's like to be in a situation where management can dictate everything. They can change your pay at their discretion without discussing that with anyone. They would give us up to 12 patients on a surgical floor. So I'm here to defend having a contract, having decent health insurance, and just out here to fight with my coworkers, fight for patients, patient safety, because I want better staffing. I think our patients deserve better care.
Well, we're striking for patient safety and for safe staffing and for our patients and for healthcare. We don't want to go on a lesser plan, that the core plans that the Allina is offering us are not as good as our MNA union-backed plans. So that's why we're here, and that's why we've been here.
My name is Dave Young, and I am a SEIU member and a nursing assistant here at United Hospital. And I'm here in support of the MNA Nurses, just simply because we have to stand together. An injury to one is an injury to all of us. And I work side by side with these nurses every day. And I'm not even kidding, it's my unique honor and pleasure to work with nurses like this every day. So it's my honor to be out here standing next to them on the picket line, standing against Allina and their unbridled corporate aggression. So SEIU has always stood side by side with MNA, and we will continue to do so.
I've worked in intensive care unit for 35 years as an RN. I've worked over 20 of that here at United. My goal of striking is to provide safe patient care by staffing ratios that we need to be able to do the cares that the patients need safely and safely for us. We're also very concerned about violence in the workplace. It seems to be an increasing issue, and we want protection and things in writing to protect us, the staff worker. Every one of us pretty much has been attacked by a patient, and it's a very difficult thing to go through. The other thing we're striking for is to preserve our union and the benefits that we have worked years and years and years for. We want this career to go on to our children, and we want them to have something when we move on and they're taking care of us. If you take away our health care, I don't think we can safely take care of us. And I think that will be one less drawback to encourage new RNs to come into this career.
I'm a nurse. I choose to be a nurse here at United Hospital because I love taking care of people. And I feel that the people in my care deserve the best care no matter who they are, where they come from, what class they are classified to. But I am also here because we need to be able to deliver this care in a safe manner, be able to be compassionate and spend more than 10 seconds 30 seconds at a bedside passing a med. We need to actually be able to listen to our patients, hear their complaints, address them appropriately.
I'm here for a couple different reasons. One is I believe that the healthcare we have, we need to try to maintain, not just for us, but for others. I just think Allina needs to be fair with their negotiation, be open to the discussion. And then I would like to see some discussion around patient staffing ratios. Allina talks about having discussed the healthcare for the last decade. On the same hand, the union has tried to discuss the staffing ratios. So I think if we're going to discuss one, we should be able to discuss both.
I'm a nurse at United Hospital, and I am here on strike today to support nurses in getting the resources that we need to provide safe and compassionate care. I also support the nurses in maintaining the health care services that we have had in the past.
Because I am a nurse by choice. I think all of us are out here today because we love our jobs dearly and can't imagine us doing anything else for the rest of our lives. And a big component of that love has to do with holistic nurturing care for our patients. And I believe that in order to do that safely, we're out here to protect the resources that we need to effectively practice this patient care that we as nurses know that we were born to provide our communities. There's just no, the feeling of knowing that maybe your employer's not behind you or not willing to support you in a way that allows you to do the absolute best job you can it keeps us up at night, because again, this is what we've chosen to do our entire life.